Okay, so let's start with the second part of the sports rehab lecture. Okay, so for today, we'll be having the lower extremity musculoskeletal sports injuries, now coming from the hip and thigh up to the ankle part. Okay, so we'll be starting with the soft tissue injury agad. No? Unlike your shoulder, no, we had the discussions of the dislocations, no? Kasi, as we all know, the shoulder, no, it sacrifices its congruity to each other, yung articulating surfaces, to achieve a large degree of freedom. Okay? Unlike your hip, hindi ganun yung nangyari, no? Talagang fit na fit si femoral head into your acetabulum. Therefore, there's a rare event kung saan magkakaroon tayo ng dislocation of your hip. No? Usually, it's due to traumatic or your dashboard injury, if you will remember, no? Wherein, due to the dashboard injury, pwede pa, no? Somehow ma-dislocate yung femur. Okay, wala na ako. Alright, so let's start with the soft tissue injury. Okay, starting from the piriformis, okay, which is also known as your piriformis syndrome or piriformis impingement. No, it's good to know that your piriformis, alam nyo kung saan siya naka-locate, no, which is at the deep part of the buttocks. Okay, wherein it originates from the anterior surface of the sacrum and inserts into the upper border of your greater trochanter. Okay, so much for that. No, hindi tayo masyadong magdadwell again sa mga basic infos, no? More on assessment tayo and treatment, no? But it's good to know that dapat alam nyo that the sciatic nerve, very important siya, no? Sciatic nerve exits, no? Right in front or below of the piriformis. Okay, so if ever magkakaroon ng piriformis syndrome, most likely we would have neurological features as well. Okay, so one of its feature, no, in etiological factors, okay, sometimes the piriformis syndrome results from the pressure on the sciatic nerve. Okay, usually due to the aberrant course of through the piriformis muscle. Okay. Sometimes then, no, etiological factor niya is the muscle strain itself. Okay, it may be acute or chronic. Alright? And it may be associated with chronic muscle shortening. So, it's very important if you have patients who have this condition to teach them the self-stretching for your piriformis. Okay? Usually, no, it will present deep buttock pain. Okay? Ang aggravation niya would be, no, as you interview the patient and have a thorough physical examination, you would know that the aggravating factors would be sitting, climbing stairs, and squats. Okay? Sitting, climbing stairs, and squats. Kung saan, no, all of these activities, okay, the piriformis is being stretched. Okay? And an increased pressure is put on the piriformis, no? And the sciatic nerve as well. Okay? You would also have, no, yung pain behaviors niya. Okay? Aside from the aggravating factors that I have mentioned in your physical examination, no, during the passive IR of the hip, okay, makikita nyo that it is reduced. Okay? Passive IR of the hip. Na hindi na malilito paano yung passive IR. Alright? And during the resisted abduction, okay, ang position ng patient would be in, initially, would be in hip adducted and then flex. Okay? Flex. Okay? And then, you would have it in a resisted abduction. Okay? That would also reproduce the pain. Okay? Again, ang position ni patient, naka-hip adduction with flexion, and then you ask the patient to abduct, and then you would resist that. Okay? And then that would reproduce the pain. Okay? Another thing, no? Para that would result into in aggravating the pain, okay, is also by resisting the external rotation. Okay? Resisting the external rotation, again, ang ating initial position would be hip and knee are flexed. Okay? With the initial position of IR. So, ibig sabihin, nakapaloob siya. Okay? Kumbaga, kung yung wrist ko siya yung knee, okay, kunwari naka-flex. Okay? And then naka-IR. And then you would ask the patient to do ER. Pero i-resist niyo yun. Okay? That would also result into pain. Okay? So, pagka yung dalawang yun positive, that would most likely be a piriformis condition. Okay? We have two piriformis conditions. No? We have the sign of Pace and Nigel, if you are going to remember, and Freiberg sign. So, what would be the difference? No? In your sign of Pace and Nigel, there is pain and weakness during abduction and external rotation. Okay? During abduction and external rotation, meaning that's active contraction. Okay? In your Freiberg sign naman, no, there is pain even on the passive medial rotation. Okay? Of an extended hip. Okay? Of an extended hip. Okay? Yun naman si Freiberg sign. Okay? Pain on the passive IR. Okay? Of the hip while it is extended. Okay. There's also a abnormal neurological symptom of the posterior thigh and calf. Okay, this is important kasi baka sometimes no aakalain niyo na it's a low back pain. Okay, with neurological involvement. So, talagang important yung medical history, patient history, and thorough physical examination to different which, okay, kasi medyo magkaparehas sila. Alright, somehow. Pero if you would perform this as well together with your LBP assessment, you would know that it is a piriformis condition. Especially, no, dun pa lang sa tender to palpation yan, nandun na sa piriformis area lang. Okay, so how do we treat this? Okay, in treating your piriformis condition, okay, you stretch the external rotators. Okay, stretch for the external rotators. How would we do that? Okay, you the hip is placed into flexion and adduction. Okay, and then you alter into ER and then IR. ER and IR. And then of course, this stretching, no, static stretching siya. So ER, okay, about 30 seconds, okay, and then IR. Okay, so you alter that. Okay. That's for your stretching, no? Pero syempre, more on IR tayo para ma-stretch talaga siya. Okay? Pero, sometimes, no, yung flexion, adduction, and ER is enough na din. No? Nasa-stretch din siya sa position kasi na yan. In your electrotherapeutic modalities, no, ito yung mga laser, ultrasound natin. Okay, in your soft tissue therapy, it's more of sustained longitudinal pressure. Okay, so ito yung na-discuss natin during the LBP lab din, no, yung soft tissue therapy doon. Okay, yung gagamitin nyo would be yung sustained longitudinal pressure. Okay, right on the belly of the piriformis muscle. Okay? So, initially, no, ipapassive ER nyo siya, and then moving into IR, while sustaining the longitudinal pressure. Okay? That would be for the soft tissue therapy of your piriformis. But, syempre, kailangan up to the patient's tolerance. Okay? Ayan. Now, let's go to the anterior thigh pain. Wala masyado. Okay? Again, wala tayong dislocation issues masyado, so hindi natin siya i-cover here. Okay, in your anterior thigh pain, this is actually the site of common sporting injuries. Usually, there is a referred pain, no, in your hip, SI joint, or the lumbar spine. So, again, no, magkakaroon ulit kayo ng dapat thorough physical exam, no, in the usual patient na hindi nyo talaga alam pa yung diagnosis. You would have to do the LBP assessment and the assessment for your anterior thigh pain. Okay, so usually sa anterior thigh pain, no, the usual diagnoses are your quadriceps muscle contusion or quadriceps strain. Okay? Or it could also be your myositis ossificans, no? So, out of those three, no, yung contusion tsaka strain, yun yung pinaka-pwede nating ma-address. Okay? So, let's start with the quadriceps contusion, or also known as the Charlie horse or cork thigh. Okay, Charlie horse or your cork thigh. Usually, quadriceps contusion is common in contact sports, no? Football, basketball, hockey, or cricket. Okay? Dito kasi, no, in your quadriceps contusion, ang primary na damage dito is the myofibrils. Okay? Myofibrils, fascia, and the blood vessels, no? Kapag ka merong during contact sports, no, nababangga. Alright? And then masyadong mainit yung laban. So, it could result to that kind of trauma. Okay? There would be localized bleeding, and then yung localized bleeding would turn into an increased tissue pressure, okay? And then cause a relative regional anoxia. Okay? So, yung MOI niya, no, it could either be, actually hindi MOI, but yung pinaka cause of quadriceps contusion itself, no, hindi MOI. Cause of the quadriceps contusion, it could either be your intramuscular hematoma or your intermuscular hematoma. What is the difference? Okay, in your intramuscular hematoma, the hematoma is confined within the muscle compartment. Okay, ibig sabihin, nandun lang siya sa loob ng fascia. Alright? And when you assess, okay, the pain aggravating factors would be a restrictive ROM. Okay, restrictive ROM. And then in your intermuscular hematoma naman, okay, the blood escapes outside the fascia. Okay, it escapes outside the fascia and is distributed between the compartments of the thigh. Okay, so ibig sabihin, medyo mas malaki yung coverage ng intermuscular hematoma. Okay, so common features, no, or ito na yung pinaka-MOI natin, no, there is a direct blow to the anterior thigh, no, which is commonly encountered in your contact sports. Okay, there is tenderness and swelling, no, upon palpation, mapapansin niyo there is tenderness in the anterior thigh, and there is pain during ROM, no, both your passive and your active. Okay, and it worsens, no, the pain worsens on active contraction and when you stretch the quadriceps, no. So, by now, dapat marunong na kayo mag-stretch ng quads. Okay, kabisado na dapat yan. Alright, so, to know the severity of the quadriceps contusion, okay, you would know it by within after 24 hours, you do the passive knee flexion. Okay, the more that it is restricted, the severe it is. Okay, the more severe yung condition ni patient. Okay, so if ever na medyo malaki yung passive knee flexion ni patient, konti lang yung nabawas, then hindi siya ganun kagrabe. Okay. So we have for the treatment, no, we have stages, okay, for treatment of your quadriceps contusion. Okay? Yung stage 1 and 2, parang sa ankle sprain lang siya, no, rise. Okay? More on rise yung pinaka-principle. Okay? Ang aim lang natin with your stage 1 is to control the hemorrhage. We don't want further bleeding. Okay? In weight bearing, no, if hindi kaya ni patient ang full weight bearing, alright, pwede siyang mag-crutches muna. Okay? And then, you apply gentle passive stretching to onset of pain. Okay? Up to the onset of pain. Alright? And then, for the strengthening, no, static muscle contraction, no, if possible. Okay? Meaning, no, more on isoms muna. Okay? Hamsets, okay, mga ganun muna. Wala muna yung mga dynamics natin. Okay? So, in here, no, in your stage 1, dahil nga rise siya, no, you could also make use of ice, no, para matigil yung bleeding, no, elevate, okay, compress, yung mga yun. Yung RICE mismo na principle, i-apply nyo siya sa stage 1. Of course, this is after your examination na. Okay? Once na talagang sure na kayo that quadriceps contusion is the problem or strain. Okay? In your stage 2, RICE principle pa din, but our aim here is to restore and maintain the pain-free ROM and the muscle strength. No? Yung kung saan pain-free pa, you have to maintain that. Okay? And then, for the weight bearing, no, you progress to partial weight bearing. Okay? And kung kaya ni patient, full weight bearing, no, as tolerated, pwede din naman. Okay? In your stretching, no, before, kapag masakit na, hindi na natin siya i-push further. Pero dito, medyo i-increase na natin yung stretching. Okay? Pero still, static stretching pa rin siya. For the strengthening naman, okay, still static muscle contraction, okay, inner range through the ROM. Okay? Ito, through the ROM na. So, yung kanina, more on isoms lang tayo. Okay? And then, we would have stationary exercise muna. Wala mo ng full weight bearing exercises like your stationary bicycle, your pull therapy, concentric and eccentric exercises. No? Wala muna tayong full weight bearing. No? Puro nakaupo muna si patient. Okay? Ayan. So, more likely, more on open kinetic chain exercises muna. Okay? And then for stage 3, this is functional rehabilitation. Kung mapapansin nyo, wala tayong time frame dito. No? Depende kay patient yung kung kaya na niyang mag-progress or hindi pa. Okay? Pero hindi, you don't have to be really aggressive with this one. No? So, you have to, before progressing to the next stage of treatment, you have to observe first the patient, no? Kung consistent yung progression niya. Okay, before you progress talaga to the next stage. Okay, in stage 3 naman, functional rehabilitation. Dito, talagang pwede na mag-full weight bearing si patient. Okay? In your stretching, okay, you maintain stretch. Okay, you have to still stretch the patient, pero increase nyo pa din. Okay? Yan. For the strengthening naman, no, all stage 2 exercises, okay, gawin pa rin natin siya, pero kumbaga, gradually increase nyo lang. Medyo papahirapan nyo lang. It could be increase the repetition or somehow increase the load, either one of those. Okay? You also include here the squats, the step down, okay, hop, jumping, and running. Okay? In here, you increase the eccentric exercises. Kasi nga, 'di ba? Usually, no, doon nagkaka-strain ang any muscle. Okay? Because if you are going to remember, no, our eccentric contraction has the highest tension. Therefore, we would want to train the patient to have a better motor recruitment and a better strength and power for the muscle, no, to withstand the tension. Okay, so hindi nyo naman siya bibiglain in these eccentric exercises. Okay, in these eccentric exercises po pwedeng dahan-dahan, no? You should gradually introduce these exercises. Last would be your stage 4, no, gradual return to sports. Okay? So, dito more on kicking actions, multidirectional activities, plyometrics, and sport-specific drills. Okay? Sport-specific drills, so kung ano yung sport ni patient, yun yung papagawa nyo. Okay? And then, dito na yung you would identify the training errors, if meron, okay, and change it. Paano nyo malalaman ano yung mga training errors na yun, okay? Very simple lang siya, hindi siya masyadong complex, okay? Yung proper body mechanics, okay, dapat, yun lang naman yung i-observe nyo dun sa patient, okay? Yun, proper body mechanics. And then, if the patient, no, is pain-free na, okay, the patient could return to sports na. Okay? That's for your quadriceps contusion or strain. Now, medyo mabilis lang tayo sa hip, no? Kasi usually, ito yung mga pinaka-common talaga na problem. Okay, let's go to the knee part. Okay, your ACL. Ito talaga ang maraming, if you would have an experience with a sports rehab clinic, okay, ito yung maraming patient nyo, puro ACL. Okay, a little bit of PCL. Sometimes, merong mga other ligamental tears, pero madalas ACL talaga. Okay? Ayan. No? So, this position, no, tatandaan nyo, yan ang nagiging cause ng ACL tear. Okay? Ayan. In this position kasi, ayan, ito talagang na-twist na siya. Okay? Medyo konting review tayo ng anatomy. Okay, this is your ACL, and then this is the PCL. Okay, yun nasa likod. Your ACL, no, runs posteriorly and superiorly. While the PCL naman runs anteriorly and superiorly. Okay? Both of which, no, are known as the cruciate ligaments. No? Anterior cruciate ligament and your posterior cruciate ligament. Okay? Si ACL, no, the role of it is it prevents forward movement of the tibia. No, forward movement of the tibia. So, in relation to the femur. Okay? It would also control the rotational movement. Okay? So, yung ACL nyo, this is important, no, for control in pivoting movements. Okay, mga pivot movements natin. So, yung mga ikot-ikot natin na movements. Alright? So, para siya mag-control din. Okay? So, without an intact ACL, no, there are some players kasi, no, naputol or nagkaka-tear na sila sa ACL, pero naglalaro pa rin. May mga ganong ibang patient, no? Without an intact ACL, no, your tibia may rotate under the femur. Okay? In an anterior lateral direction. Okay? So, parang kakaiba na yung ano nila. Minsan, ito yung, kaya magkakaroon talaga si patient ng feeling of, parang bumibigay siya. Okay? Feeling of giving way. Okay? That's for your ACL. So, ayan. Okay? So, your ACL tears, no, common siya in sports involving pivoting, no? Kasi nga si ACL, very important siya in pivoting. Siya yung nagko-control, no? Pero pag hindi na niya kinakayanan, no, sometimes yung other stabilizing factors, no, hindi kinakaya yung pivot ni patient, or bumibigay siya. And the incidence rate is greater for females than males, no? If you would if you would remember, bakit more on females than males, okay? Kasi, di ba, in your anatomical difference, mas wide kasi yung pelvis ng babae. So, therefore, they have greater Q angle. Okay? Greater Q angle, so, they also have a greater ligamentous laxity. Therefore, medyo mas mahina talaga yung kanilang ACL, yung ACL namin. Okay? So, it could also be due to hormonal, no, that adds up to the laxity of the ligaments, no, the release of estrogen and the relaxin, okay, which receptors, no, are found within the ACL, kaya mas lalo siyang nagiging lax. Alright? Yan siya. For the MOI, okay, majority of tears occurs when athlete is landing from a jump, pivoting, or decelerating, no? And itong MOI, no, is your position of no return. So, medyo review natin ng konti. I think you have covered this already from your past subjects, pero balikan lang natin. Itong nasa right side, point of no return, ito yung usually position ng patient, no? Kaya siya yung nagre-result into ACL tear, no? The back is forward flex, rotated to the opposite side, no? Talagang papivot si patient dito. Okay? The hip is adducted and internally rotated. Medyo may pagka-flex and naka-valgus. Okay, mas lalo na, no, naka-plant yung foot ni patient. Okay? Naka-plant yung foot ni patient. Ayan. Alright? Pero, syempre, position of safety, ito yung i-encourage natin kay patient. And dahil dito sa position of safety, itong muscles involved, ito yung madalas pinapalakas sa mga patients na nagkaroon ng ACL tear. No, para maiwasan na ma-put sila into point of no return ulit at maiwasan din na kumbaga ma-overpower ng mga muscles involved sa point of no return. No? So, kung mapapansin nyo, if you would have ACL patients, you would conduct exercises to strengthen these. Hip extensor, abductor, your gluteals, okay? Your knee flexor, which is your hamstrings, and then your plantar flexors, okay? Which are your gastrocnemius, and then your posterior tibialis. Okay? Ayan. Okay, so ito. No, mga sample pictures natin. Ayan, no? Naka-plant, pa-rotate. Okay, galing sa contralateral si patient. Okay, medyo naka-flex. Nakaikot na siya, no? Ayan, naka-rotate na to the other side. Ayan. Ito din, isa pa, no? Ayan, naka-rotate na yung yung leg niya. Okay, so these are your point of no return. Okay? Ayan. So, one of the two most common MOI for your ACL tear, no, although we have covered the point of no return already, no, ang talagang nagiging, yun yung positionings, yun yung nagka-cause ng ACL tear. Pero, during sa mga sports, no, mapapansin nyo, one leg standing and cutting maneuvers, doon siya nangyayari, yung positionings na yun. So, if you are going to train your patient, no, going back to his sport, okay, yun yung mga titignan nyo. Yun yung mga last, i-examine nyo sa patient, no, kapag one leg standing na siya, cutting maneuver, no, i-correct nyo kasi yung proprioception ni patient, kailangan din siyang i-correct kasi yun na yung nakasanayan. Okay? Para reflex na lang na kailangan dun ako sa position of safety. Okay? So, during your history taking, no, ito yung sasabihin ng patient, no? Patient described an audible pop. Okay? Audible pop, no? Parang katulad lang sa Achilles tendon, ganyan din. Pero mas matindi. Okay? Kasi mas makapal yun na, kumbaga yung tendon na yun, tas makapal. Okay? So, ganito rin yung nire-report nila. Merong audible pop. Okay, complete ACL tears are extremely painful, especially few minutes after the injury. No, kapag during contact sports, yung mga makikita nyo na sa mga basketball games, no, talagang napapailing sila sa sakit. Okay, pag complete ACL tear. Although there are some, no, na partial tear lang. Okay, and then ma-realize na lang nila once they go to the clinic kasi sasabihin nila parang bumibigay yung knee, or kaya naman parang ang hina nung muscles ko, okay, sa hip, okay, sa thigh, okay, ayun, for the partial ACL tears. Okay? Unable to continue activity or lack of confidence in the knee. Yan yung mga clinical features or yan yung mga makukuha nyo from patient. Okay? Before i-surgery si patient, magkakaroon mo na siya ng pre-op, usually 2 weeks. Okay, 1 to 2 weeks. Alright? In your pre-op management, no, ang aim nyo dito is to reduce pain and swelling. Okay, usually, we make use of US ultrasound, your TENS, or interferential stimulation. No? Most likely, ginagamit dito is ultrasound, no, tsaka TENS. Interferential, hindi masyado. Okay, ma-set up kasi siya. Strengthening exercises, no? Strengthening exercises, bibigyan nyo pa din both of your quads and hamstring. Okay. Pain-free ROM exercises, okay, should be performed. For the surgical intervention, no, we have types of graft. No? I-graft nyo kasi yan yung nag-tear na ACL. No? It could either be from the patellar tendon graft, okay, or hamstring graft. No? Specifically, your semi-tendinosus. Okay? Semi-tendinosus. Okay? Specifically, that one. Okay? So, yan siya, no? Ito yung itsura. Okay? So, the ACL reconstruction is actually the surgical treatment of choice. No? According, dahil nga meron tayong bone patellar tendon bone graft and meron din tayong hamstring graft, no? According to recent researches, no? Kasi before, ang sinasabi nila, they would prefer hamstring graft rather than the BPTB graft. Okay, yun yung mababasa nyo and might have discussed in your other subjects. Okay? Your patellar tendon kasi, graft, ang nagiging problem niya is, kapag yun yung gamit nila, matagal yung healing, matagal yung rehab, okay? They are prone to fractures of the patella, kaya hindi siya prefer ng mga orthosurgeons. Okay? They would prefer hamstring kasi nga, it has faster healing. And, of course, hindi ka prone to patellar fractures or dislocations. Okay? Yun nga lang, no? Medyo ang magiging problem nun is you have a decreased knee flexion power. Okay? Siyempre, binawasan mo yung tendon ng hamstring. Therefore, mababawasan talaga knee flexion power niya. Another cons for hamstring, no? Although mabilis siyang mag-heal, yung tunneling niya, no? Kasi, di ba, yan kumbaga, ita-tunnel yan sa loob pagka ni-reconstruct. Okay? Yung coming from the hamstring graft, i-reconstruct siya as your ACL. Okay? Mapapansin nyo, medyo may mga complaints of pain si patient. Okay? But according to recent research, no, ang madalas daw kasi, no, kaya yung mga ortho, they prefer hamstring graft, no, kasi mabilis niyang mag-heal. However, most of the ortho surgeons daw are not really working with the PTs. So, hindi talaga, kumbaga, hindi ganon ka holistic yung conclusion nila of whether this one's better than the other. Okay, but no, according to recent research, ito na nga, okay, the contralateral patellar tendon graft is way better than your hamstring graft and the bone patellar tendon bone graft. No, si bone patellar tendon bone graft kasi, kung saan ka nagka-ACL, dun din babawasan yung patellar tendon mo. Okay, dun din siya binabawasan. Pero, in recent research that they have conducted, ang binabawasan nila yung kabila. Okay, yung kabila, binabawasan. And then, yun yung igagraft. Okay, ganon. And after, after your rehab, no, 6 to 9 months of rehab, they were able to conclude that hindi naman siya nagiging problem. Okay, kumbaga, it results to symmetrical power, symmetrical control, unlike yung ating hamstring graft, ipsilateral hamstring graft, and BPTB, kasi ang nangyayari naman doon, na-overpower ng isang leg yung isa. Okay, ganun yung nangyayari. Okay. Evidence of effectiveness of your ACL reconstruction, you could immediately weight bear. However, most orthosurgeons wouldn't really advise yung immediate weight bearing. Okay, para lang sure. Okay, and then close kinetic chain exercises with a knee range of less than 60 degrees. And open kinetic chain exercises with a knee range of less than 40 degrees are permitted. Okay? High intensity NMES plus the active contraction are also permitted, no? Ito usually pagkatapos ni patient mag surgery, okay, binibigyan na siya ng mga exercises na to. Although, in my experience, no, sa Moro, okay, marami magagaling na mga PT doon. Pag naging intern kayo, if ever ma-assign kayo doon, marami kayong matututunan. And talagang i-maximize nyo, no? Kasi, para sa akin yung mga magagaling na manual PTs nandoon. Okay? Magagaling silang lahat. Okay, medyo stricto lang, pero okay din yun kasi para talagang maging okay kayo as PTs, no? So, they don't really give open kinetic chain exercises muna. Okay? Close kinetic muna. Alright? After the surgery. Okay? A little later na tong open kinetic chain. Okay? Mga siguro 4 to 8 weeks after the surgery. Depende sa response ng patient. Okay? Usually, they would base it on the ROM of the knee. Okay? Yung active knee ROM niya. Pag nag-exceed na siya ng 90 degrees yung ROM, dun siya pinapayagan magkaroon ng open kinetic chain. Provided that yung muscles niya sa hip, no, ay okay. Hindi ganun ka-weak. No, minsan kasi yung iba, due to hindi sila pinapag-weight bear, nag-atrophy yung muscles. Okay? Ayan. Okay. In your phase 1 post-op, okay, so ito na nga siya, 0 to 2 weeks, no, you protect the graft fixation, minimize effects of immobilization, kasi naka-immob nga to eh. The patients are not allowed to weight bear muna. Okay? Control inflammation, achieve full extension. Okay? And at least, ito na yung sinasabi ko kanina, no, 90 degrees of knee flexion. In your patient education, no, si patient sasabihan, no, bawal mag-hop, tumalon, okay, avoid alcoholic drinking. Ito yung isa sa mga pasaway sa mga patient, no. Talagang umiinom sila ng alcoholic beverages, so medyo bumabagal yung healing. Okay? Swimming, low chair sitting, okay, kasi nga medyo mafo-force yung knee into a maximal flexion, so hindi pa siya pwede kasi. And then running. Okay, bawal na bawal yung running. Okay. In your exercise program nun, naka-knee immobilizer pa tong si patient. Okay, ibig sabihin, hindi pa talaga niya pwedeng galawin, kaya nagma-muscle atrophy. Okay? You make use of ES, no, para hindi masyado mag-atrophy. Ice, okay, nilalagay yung ice dun sa knee, okay, para hindi masyadong painful during the the rehabilitation, no? So, before and after, ina-ice yung patient. Patellar mobilization, heel slides, no? Kumbaga, si patient, no, naka-long sitting siya, tapos heel slides, as in the heel, okay, you put it from a long sitting position, yung heel ipapaabot nyo up to the butt area. Tapos straight ulit, and then up to the butt area. Okay? So, kumbaga, hanggang sa maabot ni patient yung comfortable knee flexion para sa kanya. Okay? And then, we have setting exercises and co-contraction. Ito yung hamstring sets and your quad sets. Your quadriceps settings. Okay? And then, co-contraction. In our lab, we will be discussing how to do this. No? Pero yung naka-assign dito, no, kailangan yung i-search for yourself kung paano yung setting exercises na yan. And then, we would also have non-weight-bearing gastrocsoleus, hamstring stretching, sitting, prone hangs, no? Prone hangs kasi, hindi full ang extension madalas ni patient. So, kailangan siyang i-prone hangs. Ibig sabihin, while naka-prone si patient, tas medyo nasa edge, yung lagpas sa edge, yung knee ni patient, no? Lalagyan niya siya ng something heavy. Okay? Para lang somehow gradually ma-force into full extension yung knee. Hindi naman natin i-force talagang agad-agad, pero gradually lang. Okay? And then, single leg raise on all planes. Okay. Partial weight bearing to full weight bearing, this is optional. Okay? Kung depende sa clearance ng ortho. Okay? Yan kasi pagdating dyan, kailangan may clearance ng ortho. With the weight bearing. Okay? Phase 2. No, restore normal gait. Okay? Restore full ROM, protect the graft fixation, improve strength, endurance, and proprioception. Okay? This is about 2 to 4 weeks. Okay, itong ACL program na to, kailangan kabisado nyo to. Okay? Although, syempre, gets ko naman, hindi nyo siya agad talaga ma-appreciate unless you have your own patient. Okay? But it would be good kung alam nyo na kasi siya before you go to your rotations. No? Para mas, kumbaga, dun na kayo sa mga complicated stuff pwedeng mag-concentrate in learning. Okay? So, for your exercise program, forward stepping to lunges, no? Kumbaga, forward lunge. Okay? Or forward stepping muna and then ila-lunge nyo na siya, pwede. And then, wall slides. So, from heel slides, you progress it to wall slides. And then, you still maintain the patellar mobilization. So, parang scap mob lang din siya, no? You have to grab the patella and then move it forward, backward, side by side, rotate. Upward rotate, downward rotate. Okay, ganun lang. Tapos times 100 reps ulit. Close kinetic chain, no, mini squats, okay, about 0 to 30 degrees. Ito kailangan, hindi pwedeng tansya-tansya lang. Kailangan talaga i-measure nyo na 30 degrees lang pwedeng ibaba ni patient. Itong mini squats, with support pa to ng wall. Okay? Nasa wall si patient and then magmi-mini squat siya 0 to 30 degrees. Okay, tapos i-maintain niya yon. Usually, what we do in clinics is, habang naka-squat si patient, may bola between the knees ni patient para ma-incorporate din yung exercise with your VMOs. Okay, with your VMOs. Yun. So, we ask the patient to do mini squats, no, 15 seconds hold, 10 times, 3 sets. No, dito, dahil mga athletic patients sila, binubuo natin yung 3 sets. Unlike yung mga previous natin, no, LBPs, ADCAPs, okay, we only ask them kung ano yung sets na kaya nilang i-tolerate. With this one, kailangan 3 sets talaga. Okay, 3 sets. And then we would have toe raises, okay, if the patient is allowed to have a full weight bearing na. Okay, so that is optional in your phase 2. And then weight bearing stretching exercises. Okay, you will have to incorporate here stretching exercises of quads, okay, hamstrings, yung mga usually stretch, rectus fem. Okay, usually yon. Wala masyadong stretching with your with your plantar flexors, dorsiflexors, wala masyado. Pero yon, yung tatlong yon, kailangan meron siya. And then, core muscle strengthening, no? Plankings, no? Pinapagawa na natin siya kay patient. Okay? Ayan. That's for your phase 2. Phase 3, okay? Improve confidence in the knee. Okay? Kasi, syempre, medyo matagal silang, kumbaga, they had surgery. Yung iba, lalo pagka first time, parang takot nang igalaw yung knee. So, we would have to set a goal na i-improve nila yung confidence nila sa knee para makabalik sila sa laro. Although, merong iba naman, sobrang optimistic, no? YOLO. Okay? Gusto na maglaro kahit na alam nilang na ACL na sila. Okay? Graft protection, still. Protect the patellofemoral joint. Progress strength and power proprioception, no? So, yun na nga, no? Kailangan natin i-train si patient, no? For the proper proprio. Okay? In week 6 to 4 months, okay, as with phase 2, with increased difficulty, no? I-increase lang natin, no? It's either tatagalan natin yung seconds hold, increase natin yung repetitions, pero 3 sets pa din, okay? Or increase natin yung load. Okay? Ayan. Tapos, meron na tayong weight jump and land drills, no? Sorry, jump and land drills, no? Usually sa box, no? Mababang mag-start muna sila sa level surface. And then i-advance mo na lang siya. Meron kayong box, tas doon tatalon siya pataas. Okay? Hanggang sa, meron pang level yun, no? Level 1, 2, 3, 4, 5. Yung 5, talagang mataas na siya, no? Siguro mga nasa 3 feet yung taas, ang level 5. Talagang tinatalon yun ng mga athletes, no? And what you would have to observe there is, ang landing ba sabay? Okay? Yan, check nyo. Ang landing ba sabay? Okay? Maingay ba? Kailangan kasi medyo tahimik yung landing. Kasi, you would have to incorporate yung core strength nila, no? Kung mahina ang core ni patient, yung landing plakda, no? Parang ang ingay. Okay? Pag nag-land siya. No, kung face-to-face sana tayo, pwede nating i-demo to, no? But for the, dun sa naka-assign dito, you would have to do this, no? Yung jump and land drills, no? Different levels. Okay? Advanced close kinetic chain, no? Like your single leg stance and your leg press, no? Up to 0 to 60 degrees, no? Usually, in a sports rehab clinic, meron silang mga gym equipments, okay? Para itong mga exercises na to, pwedeng gawin. For the reporter, for the group that will be assigned here, no need to do the leg press na kasi naman, for sure, baka wala kayong gym equipment, so I understand that. At least yung single leg stance. Okay? In your single leg stance, no, yun. Pwedeng, meron siyang 60 degrees, no? 0 to 60 degrees na i-maintain. Mini band series, this is for your gluteals. Okay? Si mini band series. Okay? And then, monster walk. Okay? Search nyo kung paano yung monster walk dun sa ma-assign. But in our lab, no, i-revisit natin siya. Single leg stance with wedge as well. And then, for your 4 to 6 months, no, return to sports, no. Ito yung more on sports-specific programs na tayo. Gradual return to sports, maintenance program, agility, plyometrics, jumps, okay, braiding, carioca, ladder. So, more on, ang tinatest natin dito is yung training errors ni patient, ina-identify natin so that matuturuan natin sila, no, para maiwasan na yung ACL tears next time. Okay. Ayan. Next, you would have the PCL tear. Okay. Up to 60% of your PCL injuries involve disruption of the posterolateral structures. Okay. Ang primary stabilizers are your LCL and popliteus complex. Okay? PCL injuries are often associated with meniscal and chondral injury. No? So, usually, kapag ka PCL, may other problems ka pa. Okay? So, si PCL tear, no, hindi siya as common as the ACL. Okay? Due to yung PCL kasi, medyo mas matibay siya as compared to your ACL. Okay? Mas common pa yung meniscal tear than your PCL. No? So, ayan. But usually, pagka may PCL tear ka, meron ka ring meniscal tear. No? Mauna muna si meniscal tapos si PCL. Okay? For the clinical features, no, MOI would be direct blow to the anterior tibia. Okay? Pagka may direct blow ka to the anterior tibia with the knee in flex position, okay, most likely yon, pwede kang magkaroon ng PCL tear kasi kabaliktaran naman siya ni ACL. Si PCL naman, it prevents naman the posterior translation of that tibia kasi. Okay? So, patient complains of poorly defined posterior pain, sometimes involving the calf. Okay? There is minimal swelling. And in your assessment, no, posterior drawer test is the most sensitive and indicative test. Okay. Ito yung tibia, no, i-draw nyo posteriorly. So, if there's an excessive posterior, kumbaga meron kang posterior movement, okay, excessive posterior movement, then it's positive, no, na meron siyang PCL tear si patient. Posterior sag of the tibia, pain and laxity on a reverse Lachman's test may also be present. Pero mas okay na yung posterior drawer test. Okay. In your PCL tear, we have grading, no? Grade 1, 2, and 3. Okay, so kindly review the grades 1, 2, and 3. PCL rupture can generally be managed conservatively with a comprehensive rehab program. No? Surgical reconstruction is indicated when the PCL injury occurs in combination of the posterolateral structures or where significant rotatory instability is present. So, hindi masyado nire-require dito yung surgical intervention. However, no, we would have still a phase or stages of rehabilitation for your PCL tear. Okay? So, yung rehab for your PCL tear, no, it suggests an intensive quadriceps exercise training. Okay? So, kailangan kumbaga, kay ACL tear kasi, ang i-reinforce natin or what we would want na malakas talaga na muscle is your hamstring compared to your quadriceps. Kabaliktaran kay PCL, si quadriceps naman dapat yung malakas than your hamstring. Okay? Para ma-maintain natin yung balance. Okay? Ayan. Or mag-lean towards dun sa strong side. Okay? Which is in your PCL tear, gusto natin na more on anterior tayo. Okay? Which is your quadriceps. Para yung drawing of the tibia, no, more on anterior rather than posterior. Okay? Kasi meron na siyang tendency for an excessive drawing posterior drawing of the tibia. So para ma-even out 'yun, kailangan natin palakasin yung quadriceps. Ang goal ng phase 1, no, is to improve from partial weight bearing to full weight bearing. Okay? Eliminate swelling, and there should be a 0 to 100 degree knee flexion. Okay? And also, kailangan ma-achieve ang 4 plus over 5 quad strength and 5 over 5 hamstring strength. Okay? Dito kasi, no, hindi po pwedeng bigla-biglain. Okay? Although, this is more aggressive than your ACL rehab program. No? 0 to 2 weeks to. No? 0 to 2 weeks pa lang pero meron na tayong strengthening programs. Okay, in your physio treatment, no, hindi mawawala si cryotherapy before and after the intervention. Okay, cryotherapy and then electrotherapy. Okay, and then compression, manual therapy, gait re-education, and patient education. Okay? Pero, pagka kunwari, no, yung from the PCL grading kanina, the patient had grade 3, no, the patient would be immobilized for first 2 weeks. Okay? Immobilized muna siya, hindi muna siya pwedeng mag full weight bearing. Okay? So, pero dapat naka-keep in knee extension yung patient. For your exercise program, no, there is gentle flexion ROM exercise. Extension ROM to 0 degrees, no? Kailangan kasi ma-achieve yung passive full knee extension. Very important yun. Mapa ACL or PCL man. Okay? And then, quads and VMO settings. Okay? Supported by lateral calf raises. Okay? Or yung toe raises mo, yun din yun. Okay? Hip and abduction and extension. Hip abduction and extension exercises. Hamstring, pulleys, and gait drills. No? So, phase 1 pa lang, medyo intense na yung exercise ni patient. Okay, for your phase 2, dapat wala nang swelling. Okay, full na yung ROM. Tapos, ito pa rin yung goal natin for your phase. No? Same as yung strength ng phase 1. For the time post, okay, it's 2 to 4 weeks. Exercise program, no? Almost the same lang. Ang dinagdag lang natin dito is your balance and proprioceptive drills. Ito yung kung saan si patient pwede siyang balance on one foot or pwede yung dalawang foot pero nasa rocker board. Okay? Pagka one foot naman, pwedeng on level surface muna, sa floor muna, and then level 2 niya would be your towel, no? Yung rolled towel, tapos dun nakalagay yung paa ni patient. Okay? Yun siya. If you would want to progress the balance exercise, okay, po pwedeng habang naka-single leg stand si patient, okay, single leg stand si patient, no, po pwede siyang ball passing or ball catching, no, pwede yon. Yan siya. Ano pa ba? Yan, leg press, no, double and single leg. And then your mini squats and lunges, no, yan yung mga additionals natin. Okay, in your phase 3, no, full ROM, full strength and power. Okay, return to jogging, running, and agility. Okay, return to restricted sports, specific drills, and ito ay 4 to 6 weeks lang. So, medyo mas mabilis yung recovery talaga pagdating ng PCL. In your exercise program, no, parang katulad lang siya ng ACL, no, whenever we reach the phase 3, okay, parang katulad lang siya ng phase 2. Pero, kumbaga, gradual increase lang yung difficulty of the exercises. Okay, and then lastly would be the phase 4. Okay, wherein ito na yung return to sport. About 6 to 10 weeks, no? And then yung treatment, okay, and the program, ganun pa din. Okay, you just have to increase the difficulty of the exercise. Okay. Next is your meniscal tears. Okay. In your meniscal tears naman, no, we all know that the menisci is very important. Okay? Kasi siya yung nag-act as shock absorbers, no? Kung maalala ninyo, in your kines, no, ang nakaka-receive ng greatest tension whenever we jump, whenever we full weight bear, no, ang nakaka-receive ng greatest tension would be the knee. Okay? Would be the knee. Kasi coming from yung pag nag-jump, no? Yung tension coming from the ankle, no? Ipapadala niya yan up to your knee. Okay? Pwede siyang umakyat pa, but then the knee really regulates the tension. Okay? Siya talaga yung nakaka-receive ng greatest tension as compared to your hip joint and your ankle. No? Yan. For its MOI, no, hyperflexion or twisting, running, or jumping. Okay? Symptoms would be pain on extreme movement, catching, grinding, locking, and slight swelling. No? Ang end feel mo dito, parang rubbery siya. No? Sometimes, nagkakaroon ng limited or LOM because nagkakaroon ng mga, kumbaga yung meniscal tears, no, nagbablock siya towards the full ROM of the knee. For the treatment, no, ice, NSAIDs, and reduced weight bearing. And then, you have to do strengthening exercises for 4 to 6 weeks. Okay? Yan. Isa to sa problem ng patients, no, locked knee. Kasi nga, merong humaharang dun sa, may nasa stuck, no, towards the full range of motion ng knee. Okay? Kumbaga merong mga kumakalat, no? Nagkakalat ng mga meniscus somewhere. Okay? Ayan. Next is your PFPS or patellofemoral pain syndrome. No? Usually in BPTB graft of ACL reconstruction, ito yung nagiging secondary complication, your PFPS. Okay? Si hamstrings, medyo, no? I have encountered a patient, hamstring graft siya, pero nagkaroon pa rin siya ng PFPS. Okay? So, medyo common siya sa mga, it is a common, if ever merong secondary complication yung ACL, post-ACL reconstruction, no? Ito yung one of the common secondary complication. Okay? Epidemiology, aside from that is, runners and jumpers, no? Your PFPS is often, no, kapag galing siya sa, or it was developed due to runners and jumpers, okay, usually it's bilateral. Okay? And, symptoms niya, no, dull, aching, retropatellar pain, okay, on running down hills, climbing stairs, or jumping, squatting, and prolonged sitting. Sakit yung tuhod. No, akala ni rarayuma, yun pala PFPS na. Okay? So, in your physical exam, it is important that you to perform special tests, of course, special tests, and then the patellar crepitus, no, if present. Usually, crepitus, hindi talaga siya maiwasan. May mga tumutunog talaga. But, if it's crepitus with pain, yun yung abnormal. Okay? Quads atrophy, tight hip flexor and hamstring, ITB, and then merong hyperpronation si patient. Okay? For the treatment, no, we have the McConnell taping. Yung McConnell taping, McConnell taping and your neoprene knee sleeves, ang objective nila is to draw the patellar medially. No? Usually, one of the nagko-cause ng pain kasi with your PFPS is that it moves laterally somehow. Kaya dito, ang dapat ina-emphasize would be your VMO exercises, no? Para ma-pull si patient para ma-pull yung patella ni patient towards medially. Okay? Which is ine-aid ng McConnell taping natin and your neoprene knee sleeves. Etong knee sleeves na bibili to sa mga yung mga sports, yung mga mga shop for sports equipment. Okay? And then shoe orthosis. Why? Okay, usually ang mga nagkakaroon ng PFPS are those that have flat foot. Okay? Or meron silang overpronation, ganun. Okay? So, isa rin sila sa nagkakaroon ng PFPS. So, shoe orthosis, kailangan heightened, no? Dapat ganito. Alright? Ayan. Kasi mas maayos yung draw of tension towards the knee kapag ganito yung placement of the foot. Okay? Ayan. Ito yung neoprene knee sleeves natin. Ayan. And then, ito naman yung mapapansin nyo, no, from lateral going medial. Okay? So, while applying the tape, okay, in your McConnell taping, yung hand ni patient, no, is dapat pushing the patella medially din. Okay? You're pushing the patella medially and then yung tape, no, papuntang medial din siya. Okay, ganyan. So, ito kasi nangyayari, no, sometimes with your PFPS. Okay? Nagkakaroon siya ng lateral tracking of the patella causing the pain. And then, pag minove nyo siya medially, dun kasi nawawala yung pain. Okay, so, ayan. Kaya importante to emphasize yung VMO exercises. Okay? Acute patellar dislocation. Okay? Patient reports the knee shifted. Okay? Nag-shift daw yung knee. Okay? Ang ire-report ni patient, no, there is tenderness ay on the medial retinaculum, effusion or hemarthrosis. A positive patellar apprehension test. Ito yung pagka-drino mo laterally yung patella, nagko-contract yung quadriceps. Okay? Kasi nag-a-apprehend siya. And sometimes, no, may have osteochondral fracture. In your x-ray, no, ito yung makikita nyo as sunrise view. Okay? Which pertains to isa blocks position of patella. Okay? Next, we'll have the ITB syndrome. Okay, in your ITB syndrome, no, meron siyang lateral knee pain and tenderness over your ITB. Okay, lateral knee pain and tenderness over your ITB. No, approximately dun sa distal part ng ITB. No, usually kapag running, napapansin niyo to. Training errors, no, hill climbing and rapid progression. Okay, pain on hill climbing and deep flexion exercises. Ito yung mga nakikita in your ITB syndrome. Usually, pagka ganito, all you have to do is release the TFL. No? Si ITB, hindi siya nire-release kasi your ITB, as we all know, ano lang siya, band lang siya, pero hindi siya muscle. Okay, ang kailangan nyo i-release would be the TFL. Siya yung humihila sa ITB nyo, causing the pain. So, you would have to release the TFL. Okay? Stretch and release. When we say release, no, There are a lot of approaches kasi, no? Ang pinaka okay na approach would be while doing the motion of your TFL, no, naka-sustain pressure kayo doon. Okay, sustained pressure given on your TFL. Ganun po mag-release. Okay. Jumper's knee, pain at the patellar tendon, and tenderness upon palpation. Usually, this is due to repetitive jumping or running. Okay. Ayan. So, paano nyo madidistinguish yung retropatellar pain coming from the PFPS versus your jumper's knee? Usually, no, dahil ito, yung sa jumper's knee, no, meron siyang pain at the patellar tendon. Okay? Somehow, treatment nila versus your PFPS, almost the same lang din. Okay? Almost the same lang din. Okay? So, dito kailangan ng thorough physical examination, no? Para ma-address natin yung mga other structures that need strengthening or stretching. Now, let's go to the ankle. Okay? Ankle sprain naman tayo. Ayan. Ay, hindi ko na ayos. In your ankle sprain, no, we have different ligaments. Okay? In your ankle. Okay, in ankle sprain, it could be, yung involved is your ATFL or your CFL. Okay? Yung dalawang yun, madalas ang talagang nagiging cause ng ankle sprain. Your ATFL, no? So, this is the weakest of the lateral ankle ligaments. Okay? Ang second weakest sa kanya is your CFL. Okay? MOI, no? Forced plantar flexion and inversion. Okay? Pagka forced plantar flexion and inversion, most likely ATFL yan. Okay? Because of its placement, no? Because of the position of your ATFL kung saan siya nakalocate. Pagka forced inversion lang, no, it might be your CFL. Okay? So, to rule out fracture, okay, you would have to assess the patient according to the Ottawa ankle rule. Okay, meron kasing dalawa, no? Meron yung for ankle and then meron yung for foot. So, yung dalawang yun, kailangan alamin ninyo. Okay? Sige. Check natin yung Ottawa rule na yun. No? Actually, meron din for the knee. Okay? Okay. So, yeah. Alright. So, these are your Ottawa ankle rule and foot. No? So, itong nasa left side, siya yung sa ankle rule. Itong nasa right side, siya yung nasa foot rule. Okay? So, for the ankle rule, no, an ankle x-ray series is required only if there is any pain in malleolar zone and any of these findings. No, any pain in your malleolar. Okay? So, it could be your lateral or your medial malleolus. Okay? So, para lang maintindihan niyo yung nakalagay dito sa boxes, no? Letter A is your posterior edge of or tip of the lateral malleolus. Okay? Letter B is the posterior edge or tip of medial malleolus. Okay? Ito kasi yung lateral, ito yung medial view. Okay? Letter C is the base of fifth metatarsal. And letter D is the navicular. Okay? So, malleolar zone natin, ito, bandang sa A and B. Okay? So, if you have bone tenderness at either A or B, or meaning either your lateral or medial malleolus, no? Or inability to bear weight both immediately and during the during the patient that is nandun na siya sa emergency department, no, approximately 4 steps, okay, that would mean na kailangan ni patient mag-undergo ng ankle x-ray series. Okay? Pag foot x-ray series naman, no, this would be required only if there is any pain in the midfoot zone naman. Okay? Yung midfoot zone na yon, ito na siya, yung C, bone tenderness at point C and D, no? Kung meron siyang tenderness sa 5th metatarsal, sa navicular, and inability to bear weight both immediately and during na nasa emergency department na siya, no? For approximately 4 steps. Okay? So, habol na din natin yung Ottawa knee rule. Medyo na kaligtaan natin siya, no? So, these are, yung Ottawa na to, this rule, no, kapag positive si patient dun sa mga given criterias na yun, kailangan niyang ma-x-ray. Okay? Alright, so this is the Ottawa knee rule naman, no? We would need a knee radiography naman if the patient is age 55 years or older. Okay, meron siyang tenderness at the fibula. Okay, tenderness at the patella. Okay, inability to flex to 90 degrees. At least 3 out of 5 of this, no? 3 out of 5 of this. Inability to flex up to 90 degrees. And inability to weight bear immediately and in the emergency department for 4 steps. Okay? So, yan naman for the Ottawa knee rule. So, please take note of those. No, I believe sa Clean Ed, no, na topic na siya. Okay? So, medyo madali na lang i-review. For the treatment, no, we have to have the functional stirrup, no? So, sa mga magkakaroon ng video for ankle, no, kailangan ma-demo nyo tong pag-taping ng functional stirrup. Okay? If, for example, no, wala kayong mahanap sa references sa YouTube, wala kayong makita, just message me, no, para mapasa ko sa inyo yung video ko. Okay? Kasi yung lab natin sa ano pa, next week pa eh. Okay? And then, gentle stretching of the Achilles tendon. Okay? Pag nag-ankle sprain ka kasi, ang tendency mo, nakatiptoe ka. So, there's a tendency na kumbaga, masyadong shortened si ankle plantar flexors mo. So, ayun siya. So, kailangan natin siya i-gentle stretch. And then, ankle board training, okay, for the balance training and proprioception. Okay. And then, you can progress it from stable surfaces, no, up to unstable surfaces. Okay. Yan. If the ankle sprain is grade 1 lang, no, you can return to sport by 1 to 2 weeks. If it's grade 2, 6 weeks. And grade 3, no, return to sports after several months. Ito yung talagang may tear na buo. Okay? Grade 2 is about 50% pa lang ng tear ng ligament. Grade 1, minor tear. Okay? Yan siya. Ayun. So, ito na rin yun. Alright? Okay. Stress fractures, no? We will be dealing with one stress fracture lang, no? Ito kasi yung madalas common, your medial tibial stress syndrome. Okay? Your medial tibial stress syndrome is also known as your shin splints. Okay? Shin splints, maririnig nyo. Alright? Epidemiology, usually it is seen in runners, okay? Such as yung mga basketball, volleyball, and your track and field. Okay? Etiology, no, since this is a CTD or our cumulative trauma disorder, okay, this is due to overuse or overstressing of the lower leg, which can result to shin splints, no? Kumbaga, nagkakaroon ka ng small tears in your leg muscles, okay, at the point of their attachment. Okay? Pwede rin this is due to biomechanical abnormalities such as excessive foot pronation. So, hindi talaga maganda, no, kapag flat-footed yung patient. Okay? Loss of leg flexibility, okay, and ankle LOM, no, which may lead to inflammation of the periosteum of the tibia. Okay? Ayan. So, ganyan yung nagiging itsura niya. Okay? There's overstressing at the lower legs. So, for the treatment, no, kailangan lang, mayroon lang tayong modification of yung shoe orthosis ni patient, no? Kasi nga overpronated siya. So, kailangan prosupination, no? Kailangan prosupination yung patient. Okay, and then, gentle stretching of your ankle plantar flexors. Okay, and yung strengthen na muscles dito would be your tib post and your tibialis anterior. Okay, tib post and tibialis anterior. Okay, and then gradual return to training but decrease in intensity or run on soft, flat surfaces. No? So, kailangan i-modify na talaga yung footwear ni patient para hindi na siya maulit or para ma-decrease na yung tendency ni patient na magpatuloy pa yung kanyang CTD. Okay? Ito umulit lang, no? Now, let's go to the Achilles tendonitis. Okay? In your Achilles tendonitis, no, meron tayong tinatawag na tendinosis, no? When we say tendinosis, this is very different from other tendinopathies. Ang tendinosis kasi, this is due to the degeneration, okay, of the tendon without inflammation. Okay? Wala siyang inflammation. Okay? Usually, this is seen in your runners, no? In your physical exam, no, there is tenderness of the Achilles tendon, okay, weakness of your plantar flexors, and inflexibility of your dorsiflexors. Okay? Kung tutuusin, no, your Achilles, this is the largest and strongest tendon in the body, pero subject siya for this, no, degeneration. Okay? Ang treatment natin for this, no, syempre, first of all, kailangan, dahil wala naman siyang inflammation, what we could do is strengthen. Okay? Strengthen na lang the tendon. Okay? Para ma-turn around pa natin yung degeneration niya. So, heel lifts. Okay? Ang kailangan. Okay? And then, from eccentric, no, you could also make use of concentric exercises like your lunges and your squats. Okay? Lunges and squats. So, that's for your Achilles tendinosis. Okay? Merong mas malala dito, no? It would be your Achilles tendon rupture. Okay, si Achilles tendon rupture, no, MOI niya is push off with the weight-bearing foot while extending the knee, no? Or sudden or violent dorsiflexion of a plantar flexed foot, no, na bigla. Okay? Nagkakaroon ng Achilles tendon rupture. Usually, may kita nyo to sa mga football players, no? Sila madalas magkaroon nito. Okay, ganito yung itsura ng MOI. Alright? Ayan. Tapos, pagka binuksan, may tear na pala. Ayan. Okay. In your physical exam, no, patient can plantar flex the foot but cannot perform toe raise. Okay. Cannot perform toe raise. No, definitely, mag-rule in kayo ng Achilles tendon rupture dyan. To further confirm that, you would have to do the special test. Ano yung special test na yun? Okay, it would be your Thompson or Simmons. Okay. For swelling, include the figure of 8 measurement. Okay. Ayan. For Achilles rupture, no, parang ang magiging pinaka treatment natin dito, surgical na talaga siya. Surgical intervention. And then after your surgical intervention, no, yung post-op would be strengthening. Okay? Pero hindi agad-agad 'yon, no? Gradual increase ng gradual increase or gradual introduction of the exercises, no? Kasi baka ma-tear natin siya ulit. Okay? Usually, pagka Achilles rupture, no, parang ang pakiramdam ng patient, pag tinake nyo sa patient history, akala niya may sumipa sa likod niya. So, makita nyo, if you would watch videos of athletes who had Achilles rupture, they would always turn their back, no? Kasi akala nila merong sumipa ng sobrang lakas dun sa paa nila. Okay, mapapalingon sila. And dahil ganun ka kalakas or ganun ka strong yung ating Achilles tendon. Ayan. Siya. Next is your plantar fasciitis. No, this is most common cause of heel pain. No, most common cause of heel pain. Your plantar fascia. No, this is a tough fibrous aponeurotic structure from the medial calcaneal tubercle and inserting to the plantar plates of the metatarsophalangeal joints. No, usually, ang nagiging cause ng ating plantar fasciitis is tight plantar flexors or short ang foot flexors, weakness of your posterior calf, no? Kaya nagkakaroon ka ng increased pronation. So, ibig sabihin, instead na meron siyang, kumbaga, parang nagiging flat foot ka na din. Okay? Therefore, itong mga problems na to, ito yung i-address natin in treating plantar fasciitis. Okay? So, aside from the modalities that you will apply to address the pain, ito yung mga kailangan yung i-address, no? Tight ang plantar flexors niya, therefore, you should stretch it. Okay? Short ang foot flexors, ganun ulit, stretching. Weakness of the posterior calf, therefore, strengthen. Okay? You just have to address. Okay? To make your treatment for plantar fasciitis. So, this is a picture of your plantar fasciitis, no? Nasa medial aspect siya. Usually, ang report ng patient dito, merong morning pain, no? Pagka bangon niya sa kama, masakit yung, meron siyang heel pain. Okay? So, morning. Okay? Another symptom of this would be heel, yun na nga, no? Nasabi ko na, no? Heel pain on first arising in the morning. In your physical exam, okay, tenderness with palpation over the medial calcaneal tubercle. Okay? Tapos, pronated and everted pa yung foot. No? Medyo pa flat foot siya. Okay? Ayan. Please, yung supinated foot, disregard. Okay? Tightness of your hamstrings. Okay? Weakness of the plantar flexors and intrinsic foot muscles. No? Kaya, dito yung toe crawling na exercise. Kumbaga, meron kang towel, tapos ipapa-crawl mo yung toes niya, no? Kumbaga, yung towel na yun, no, ika-crawl mo yung toe hanggang sa yung lahat ng towel, mapunta mo proximally to the patient. Okay, yun ang usual strengthening exercise natin for the intrinsic foot muscles. Okay? Ayan. These are your heel pads, no, para medyo ramdam ng ease from pain si patient. Okay. Ayan. So, that would be it for our lower X, no? So, love the sport, no? Usually, mas ma-embrace nyo kasi itong sports rehab if you yourself is inclined with sports, no? Mas naiintindihan nyo kasi yung mga mechanism of injury, no? Mas magiging familiar kayo with the certain body positionings, training errors, no? Kaya, repetition really matters, no? So, mas exposed kayo doon, mas ma-embrace nyo yung nature of how we make a treatment plan for athletes. No? Unlike the usual patient kasi, 'di ba, yung iba medyo pa tayo, conservative, okay? Dito kaya nating maging aggressive. Okay? So these are the references. Okay, I'll be uploading the references ulit dun sa book natin, no, list of references. Okay? Ayan. Alright? So, time for you to review, no? We'll have a post-quiz for your upper X and lower X, no? Hiwalay siya. Okay? Isang post-quiz for upper X and isang post-quiz for lower X. Okay? Sige. Alright, thank you.